Challenges of immunotherapy for pharmacists. They're multifold, and I'll probably miss a few trying to go off the top of my head. But for sure, I think pace of change is right up there at the top of the list. I remember, it was about a month ago, I was joking with a friend, boy, there hasn't been a new approval in a week, ha ha ha. And then lo and behold, I think there's 3 email alerts I got later that day. It's a really unprecedented pace of change that does require heightened awareness. It requires maybe awareness of finding new tools, utilizing technology better, trying to find ways to gain efficiency so you can be more aware of what's out there, and so that you're applying the absolute highest level, most up-to-date practice to your patients. My approach with all those updates is always, when they come, to instantaneously try to translate that new piece of data, whether it's an FDA alert or a new approval or new trial that's been published, is instantaneously take that from that piece of data and transition that to how does that fit in with patient care. And sometimes the answer is, I don't know that that changes anything, or sometimes it's, yep, that changes everything, and I need to find ways to disseminate that information to the rest of our group, whether it be other pharmacists, nurses, physicians, to make sure we're thinking about all these new issues. Again, it's a stunning pace, because it used to be, and I act like I'm an old timer, but when I started in practice, lung cancer therapy didn't change much for 5-6 years straight. There wasn't much new, and then all of a sudden, we've seen this initial wave of immuno-oncology, and I think we're right at the point of another wave where we start incorporating kind of novel combinations of treatment. We started with single agent, now we're seeing this flood of combination therapies, both other immunotherapies in the mix, or maybe we put chemotherapy. I don't know, I don't have a great, awesome solution, but that is absolutely just being aware that that's a real challenge, and that the way you practice today may not be, just the knowledge that how you practice today may not be how you should practice tomorrow, might be the best solution to that. Other game-changing issues, adverse events, certainly we have to be aware of it. This is a new set of adverse events that we're very comfortable with. Chemotherapy causing nausea, vomiting, alopecia, and myelosuppression. That all makes sense. Some of the older targeted therapies, we're pretty accustomed to their kind of weird set of unique side effects. But now we're in this whole new realm of immune-mediated adverse events that sometimes may be difficult to identify. Particularly the endocrinopathies often present just weakness, fatigue, patients that often just describe, I feel off, I don't feel like myself. It's pretty easy to just discount that as, well, you're an end-stage cancer patient. I'm not surprised you feel that way, but it may very well be a weird endocrine issue that we're not very familiar with dealing with. So it's been required more collaboration on our part with other colleagues and other disciplines that we're not so accustomed to dealing with. We do a lot more endocrine consults now than we used to, but we're aware that there's new adverse events that come up. Pneumonitis is another great example. Not super common, but the way it presents mimics the symptoms that lung cancer patients deal with often. So we have to have this heightened awareness that if that's how someone presents, we need to consider it could be immune-mediated events. And this goes across the board. So being aware that not only is there a new set of adverse events, but the mechanism behind it is entirely different, and we need to approach treatment differently. Unfortunately, we don't really have a lot of elegant treatment strategies. There's a few things in there, but for the most part, it's try steroids and hope things get better.